In this video, we are going to be looking at the topic, the HbA1c test. Hi, I'm Sharon. I'm working as an associate professor at College of Nursing. The following are the objectives that we'll be addressing with regard to this topic. Diabetes. It is a global health challenge, and we know that it has affected millions worldwide. This disease requires both short term and long term monitoring. With regard to that, HbA1c is a key biomarker for long term glucose control. It is one of the most important tools in the management of diabetes mellitus. This helps clinicians as well as patients to see the big picture. Let's see what HbA1c means. This stands for glycated hemoglobin. It is a measure of the average amount of glucose in blood over the past 2 to 3 months. HbA1c is formed when glucose in the blood attaches to hemoglobin in red blood cells. This attachment is called glycation. The higher the level of glucose in the blood, the higher the amount of glycated hemoglobin. Since RBCs live for about 120 days, the HbA1c reflects the average blood sugar over that period. This is reported as a percentage. It correlates directly with estimated average glucose. Unlike the daily blood glucose readings, which show immediate levels, HbA1c provides a long-term average, offering a broader picture of the blood sugar control over time. Now, let's look at the science behind the test. Here we see the binding of glucose to hemoglobin. It is a non-enzymatic process that occurs continuously. So, how does the glucose enter the bloodstream? It comes from the food. And then this glucose attaches to the red blood cells. And when we do a HbA1c measurement, the lab test will quantify the glycated hemoglobin. And this will reflect the 2 to 3 months of sugar levels. The significance of HbA1c. This test is considered invaluable because it provides a clear picture of long-term blood glucose control. High HbA1c levels indicate consistently elevated blood sugar, which increases the risk of diabetes complications. This test helps in risk assessment, helps identify individuals at risk of developing diabetes complications. This helps in goal setting, that is, providing a target for blood sugar management to prevent long-term damage. This test also helps in assessing the treatment effectiveness. It monitors how well the diabetes treatment and lifestyle changes are working. And also, it helps in reducing the complications. Better HbA1c control is linked to a lower risk of heart disease, kidney disease, nerve damage, as well as vision problems. The HbA1c test is widely used for various purposes, from identifying individuals at risk to tracking the effectiveness of ongoing diabetes management. With regard to screening, for adults aged 40 years and above or those with risk factors for diabetes to detect the early signs. With regard to diagnosis, to officially diagnose pre-diabetes as well as type 2 diabetes. With regard to monitoring, it is used regularly for people, those who have been diagnosed with diabetes, to assess their blood glucose control over time. Now, let's look at the interpretation of HbA1c results. It is a key to managing diabetes. The results are typically given as a percentage. Less than 5.7% indicates normal blood sugar levels. If the value falls between 5.7% to 6.4%, it indicates prediabetes and that there is increased risk of developing type 2 diabetes mellitus. When the value is more than or equal to 6.5%, it indicates that the person has diabetes. The target in diabetics is usually less than 7%, and it may be individualized based on age, comorbidities, as well as the risk of hypoglycemia. For a healthy HbA1c level, often involves a combination of lifestyle changes and for some patients, medication. With regard to healthy diet, the patient can be asked to focus on whole foods, lean proteins, and plenty of vegetables, and to limit processed foods and sugary drinks. With regard to regular exercise, aim for at least 150 minutes of moderate intensity aerobic activity per week. With regard to medication adherence, if prescribed, take diabetes medications exactly as directed by the doctor. with regard to stress management, find healthy ways to cope with stress as it can impact blood sugar levels. These are some of the common questions and misconceptions that patients may have about HbA1c. Does HbA1c replace daily blood sugar monitoring? No. HbA1c provides an average, while daily monitoring helps understand how food, exercise, and stress impact blood sugar in real time. Hence, both are important. Next is, can HbA1c be affected by other conditions? Yes. Conditions like anemia, kidney disease, or even recent blood loss can sometimes affect HbA1c results. Always discuss full medical history with the doctor. Let's look at the advantages and disadvantages of the HbA1c test. When it comes to the advantages, it reflects long-term glucose control, not just day-to-day fluctuations. There is no need for fasting, and this test strongly correlates with risk of diabetic complications. Coming to the disadvantages, it can be affected by conditions altering red cell turnover, such as anemia, hemoglobinopathies, recent transfusion, pregnancy, and this should be interpreted along with blood sugar profiles and clinical assessment. Nurse. Nurses are central in both screening and ongoing management. With regard to education and counseling, nurses have to explain the meaning of HbA1c in simple terms to patients and families, reinforce the importance of lifestyle modifications such as diet, exercise, and cessation of smoking, clarify the difference between daily sugar monitoring and HbA1c. With regard to screening and testing, nurses have to encourage high-risk individuals, such as those who are obese, those who have a family history of diabetes mellitus, those who are having gestational diabetes, or those with history, or those who are living a sedentary lifestyle to undergo HbA1c testing. They should also facilitate routine HbA1c checks every 3 to 6 months for diabetic patients. With regard to monitoring and follow-up, the nurses have to track trends in HbA1c results, not just single readings, and also report abnormal values promptly to the physician, and further support adherence to medications and insulin therapy to the patients. With regard to patient empowerment, the nurses have to teach patients how HbA1c relates to their daily sugar logs and motivate them by showing how small changes can improve HbA1c over time. With regard to holistic care, the nurses have to address barriers such as cost, fear of needles, cultural beliefs, or poor health literacy. Nurses also have to collaborate with dietitians, physicians, and diabetic educators for comprehensive care. The following are the references. Thank you for watching this video.